Well, good afternoon, everyone, and welcome to the February 1st edition of the Provider Update. I cannot even believe it's February 1st. I don't think Dr. Parahone's able to be with us today, and Dan may or may not be. But thank you for joining. And again, I'm Miranda Durham, the Northwest Regional Health Officer for the Department of Health. And okay, let's see, we have not too many updates and some good news, it looks like, in terms of case counts. Community transmission across the US remains high, not a surprise, but look at this is national data, case counts, like kind of plummeting. I wouldn't say we're quite there yet in New Mexico, but headed the right direction. Deaths, interestingly, are a lagging indicator, and they were not seeing a similar decrease in deaths. And mostly I just point this out because, I mean, through Omicron, there's the ongoing conversation about, is it more virulent or not? And overall, it does seem to be less so, and yet still people are dying from it. So something to keep in mind. This is New Mexico data from COVID Act Now, and the daily case rate, while still high, did take that turn and looks like it's coming down, so fingers crossed. And our effective also headed the right direction. So our infection rate is 1.14. Again, as it gets under, really 0.9, then we really hope to see a shrinking of the number of cases. I didn't say that very well, but it has been, that infection rate has been very high, and the cases just kept growing. So unfortunately, also on the decline are the vaccine doses administered on a weekly basis. Although 46,000 the week of 114 to 120 is not bad. And again, nationally, this is a trend. I mean, just even kind of worse than what we're seeing in New Mexico, just a downward trend in the amount of vaccine given. So, I think what we, obviously there's some days missing there the following week. It did drop lower, which is too bad, but we keep plugging along. The continued gap, this is again just looking at all the data for percent of people who've completed their vaccine, including 5 all the way up. And just, we've seen this pattern throughout the pandemic on pretty much every slide, but, lagging rates in our Hispanic, Latino community and the African-American community as well. What is interesting, I think this is a slide of, like, if you got your booster and you're eligible for, if you got a vaccine series and you're eligible for a booster, how many people have actually gotten their booster by race and ethnicity? And it's interesting that the gap is narrower here. So, basically it looks like, for most, for somewhere between 50 and 60% of people, if they got their first vaccine series, they're willing to get their booster, but there's not a big racial disparity there. Everyone's kind of, that 60% mark is sort of there for all races and ethnicities. This is just looking at the 5 to 11-year-old group, which again, I think, nationally, there's a wide range, with Vermont being, I think, #1 for this age group. We're somewhere, above middle, but, overall, I think it has been a tough group to vaccinate, and I think overall somewhat disappointing that we haven't gotten higher numbers. I don't think it's all vaccine resistance. I think some of it is busy parents and maybe not perceiving so much danger to this age group. So I think now, the enthusiastic ones have gone and gotten vaccinated, have driven through those mass vax events. And now we are, like with all age groups, we're kind of in that ground game, like person by person, just trying to be there at the right time, right place to be able to give that vaccine. I did just stick this. This is the same slide as last week on the S gene target failure. So I didn't find an updated one, but just to remind me to say also in the national news is more talk about the BA2 subvariant of Omicron, which, you know, we don't have a whole lot of information, although in some places in Europe, it does seem to have spread and may account for like a surge that doesn't slow down as quickly as you expect. I don't have official data to show, but it sounds like maybe one has been sequenced in New Mexico. So, and there's somewhere in the area of 100 plus across the United States. So for vaccine updates, the big news, although it doesn't change our lives that much, is that Moderna got full approval for their vaccine called Spikevax, which is a little easier to remember than the Comirnaty Pfizer. But and so again, doesn't really change what we do with it. It's still 18 and over, and I am still curious what is going on with their request to be able to give younger ages vaccine. So on my vaccine watch list, we've got the Moderna, the Pfizer study. So, you know, waiting for information on that, although it just started, and that's an Omicron-based vaccine candidate in being tested in healthy adults 18 through 55. So it'll be a little while before we hear anything about that. The Pfizer for kids, I should be more for little kids, and that is, sounds like they will be seeking approval soon. They've been collecting data, and so this is the 6-month to 4-year-old crowd, with a question still out there on how many doses for the primary series. It sounds like the youngest did respond to a 2-dose series, while the 2, 3, and 4-year-olds didn't do so well in responding and really needed 3. So I think there's a lot we don't know about this group, but it also sounds like it may be sooner rather than later that that they'll be seeking approval. And then Novavax, which is again a different another vaccine brand, but also different in it's not an mRNA and it's not a vaccine vector vaccine. So gives us kind of another option. I think there are people out there who've been looking at this as a good alternative for them. It doesn't, you know, scare them the way the idea of having something called mRNA injected into your body, and hopefully will be safer and safer than the Janssen vaccine and more effective. So it does have the WHO approval, the World Health Organization approval, and they had submitted data to the FDA at the end of December, and now submitted a request for approval at the end of January to the FDA. So something to watch for. It's also a 2-dose series, and I think they have embarked also on a booster study, finding that their vaccine also was not as effective against the current variants, but improved a lot with a booster dose. So again, this is just kind of the things to watch for. This is a little clip of a piece of trying to explain the nanoparticle, which is sort of broadly how some people call the Novavax vaccine. It's got a lot of steps, including, you know, injecting things into moths. So it's kind of interesting, but I'll spare you the details. And again, my favorite place is the New York Times vaccine tracker. You can get like kind of down into the nitty gritty of how each vaccine works. And this is just the Novavax press release. The immune compromise, thank you everyone for hanging in there on this information, and my apologies, there are a few people I tried to email back from the meeting last time and got bounce backs on your emails, so I must have scribbled them down incorrectly, so apologies to keep you waiting. But this is the question we were talking about last time, which is, if you started out with your Moderna primary series, and if you're immune compromised, got the Moderna primary series, and then got a booster, a half-dose booster, and then realized I really should have gotten a third primary dose because I'm immune compromised. So this is people who missed that third dose. So what CDC says is when you discover the error, if it's a different clinic day, repeat a full dose of Moderna. So just write off that half dose that you got, give the full dose of Moderna, and then get the booster in 5 months' time. It's a little less complicated with Pfizer, but same principle applies. If you got the primary dose of Pfizer and then you got something that you in your mind called the booster dose, that just becomes your third primary, and 5 months from that dose, you get your booster, and could pick a half dose Moderna if you want it. So we can come back to that with questions. Updates from the immunization program, just to let you know that NMSIS is expanding. We joined the immunization gateway after Katie Cruz on our vaccine team has worked tirelessly on this project. But that means sort of state by state, we are adding, adding of the states that also belong to the immunization gateway, which at this point is a good chunk of them, adding them state by state to New Mexico. So if you were gave a New Mexico address and got vaccinated in Nevada, that data should now be in NMSIS. It will get updated on some regular basis on the immunization side, but it also sounds like providers, when you log in to a patient who maybe has an out-of-state dose, it will give you a little option to update and import that data for them. So this, sounds like it'll be a little bit of a slow project to get us all the way up, but it will give us much better visibility. And again, I think for states like, this is kind of a funny set, but apparently like Kentucky reached out to us and was interested in getting our data. So we're partnering with them. Obviously, Arizona, Colorado are going to be more relevant for most of our clinical practices. Also, it looks like we will be able through NMSIS to get visibility on VA doses. That is still in the works, but also I think, a big step forward to having a truly New Mexico-based immunization program. So all exciting things, and not all just related to COVID. The J&J supply is limited. I'm sure most people are aware of that. But if you have supply that you don't need, there are people who are still looking for it. So let the immunization program know. And for all of these kinds of communications, you can use the covid.vaccines@state.nm.us email. The weather delays, there may be some vaccine shipment delays for 2/1 and 2/2 today and tomorrow due to weather issues in the state. And then expiration dates, just a plea from the immunization program to please double check and update gray cap and orange cap Pfizer expiration dates in NMSIS. And those expiration dates will change some depending on time in the fridge. Again, if you're having questions about that or which date you should use, covid.vaccines@state.nm.us, and they will help you out. But CDC does kind of look at our expiring vaccine again and the stock in the state to make decisions about allocations. So thank you for all the work you do. And we know it is a ton of paperwork and tracking. I just wanted to take a couple slides to talk about planning for the next age cohort, again, the 6-month to 4-year-olds. So this is just, we've looked at slides like this before, the vaccines administered by provider type. This is just using the 5 to 11-year-old crowd as a model. I think we had some questions at the time, like, would pharmacies continue to be a big player as the kids got younger? And lo and behold, yes, they were. So 46% of the vaccines in the last month in this age group have been given in pharmacies. And one of the reasons why I think, and then, obviously lots of other people joined in the effort. There's a ton of pharmacies in New Mexico. So, it makes sense that they would be giving a lot of the vaccine. However, I think as we've mentioned before, a lot of the vaccine or a lot of pharmacies do have lower age limits on who they're authorized or comfortable vaccinating. So when we talk about 6 months to 4-year-old, I think we just need to keep in mind, I think there will be more pressure kind of on this other half of the circle to be able to provide vaccine. A lot of 6-month-olds are in the office getting vaccines for other things anyway. So, I mean, it kind of makes sense. But anyway, I lost my thought. Sorry. Okay, the other thing is just looking at the 12 to 15-year-old, like sort of how they got their first doses. That's the red line. The blue line then is the 5 to 11-year-olds. So you can see as a percent of their total population, the 5 to 11-year-olds are lagging behind where the 12 to 15-year-olds were at like day 85 since vaccine was approved, which is day 0. So, again, no crystal balls, but I'm just kind of assuming we're going to have a similar, kind of decrease in the curve for this next age group. And then just if people are interested, these are the population denominators from the 2020 census data taken from a program that our EPIs use called IBIS. And this I did for the public health region, so the Northeast, Northwest, Southeast, Southwest, but if you add them all up, these are our state denominators. So overall, there's 108,000 kids in this age group. If we did, if we assume 15% will uptake in the first 30 days, which is kind of a low ball, this is how many vaccines we need to give across the state in the first 30 days. And for the next one, I picked a 30%, which is kind of more where that 12 to 15-year-old group were. And this is how many vaccines. So it's not a huge group, but if we have to give 3 vaccines for the primary series, it'll still be a lot of work. Testing options in New Mexico, overall, if you direct people to find a test, nm.org, it doesn't list everyone who tests, but it does have a good number of options. I just wanted to, for the relevant, for people in Albuquerque, Santa Fe, Las Cruces, and Hobbs, this is a new testing site that should be, they're doing a dry run today and starting up tomorrow. The Hobbs one is 1 day behind that. These are QR codes that you can scan that will take you to the scheduling app. It's very simple. It does not ask for insurance information. It's pretty quick. And they will be here at these 4 sites for 3 weeks, unless, assuming that case counts will come down in that time and demand for testing will come down. But please, please, please make use of these sites. One other test, an option for getting free COVID home tests is this Project ACT, which is in partnership with the Rockefeller Foundation. This one is zip code limited. If you go to so these are the zip codes that are eligible as of right now. If you go to their website, which is listed here, it gives you a place to put in your zip code. And if you put in a zip code that's on this list, it says congratulations, and then lets you order a test. They come in packs of 5, and it's 1 order per household. We were given 175,000 tests, which divided by 5 gives us 35,000 households. So again, if you work, live, know people in these zip codes, please, please, please let them know about this project so that they can deliver. It's being shipped out by Amazon, it's kind of a community, a community project under Amazon. So you don't have to have an Amazon account, but also looks like it should be able to get tests to people kind of more on the 3 to 4 days rather than the week to 2 weeks that the federal program's taking. In addition, the state did purchase a bunch of these iHealth rapid tests that are being distributed to community managers and then out to communities. It's a little bit different in each organization. And the green, when you go to the find a test, the green pins here are sites that are handing out the rapid tests. So that's a way that people can find how to find a test. And then there are just local websites, like this is the city of Albuquerque that did an amazing job standing up a bunch of sites, listing it on their website as well as a press release, and the list goes on from here. So that's been fun to see. The federal program, this is the federal program. And again, we just encourage everyone to get on, order a test. It might not come for 2 weeks, but at least, you can save it for a rainy day. There's still 2 options for reporting a home test in New Mexico. I think ultimately we will move to a place where we won't be looking, and these home tests, while they're being reported, are not counting in our daily totals. So people can report at this link, and it gets you a field that looks like this. You can also put it into NM Notify, which is really more about informing other people on the NM Notify app that they might have been in contact with you. And again, there is no reporting requirement, and always hard to give up data, but I think ultimately that is where we're moving, is not counting every case and doing kind of more of a surveillance like we do for flu, but we're not there yet. So in the meantime, every single lab test, positive and negative, and every test done in a clinical setting is getting reported. On the COVID oral therapeutic utilization, we have had a bump in the molnupiravir, well, a bump and decline, and then a bump up in Paxlovid. So that is great news that people are starting to prescribe. This just shows our outpatient inventory by week. And remdesivir is not something that the state distributes, so we don't have visibility so much on that. This is the OMAS score if people just want it as a reference, but again, you only need an OMAS score of 3 now for a prescription of Paxlovid or Sotrovimab. It used to be 6. The OMAS for molnupiravir went down to 1. It used to be 3, so you need fewer of these categories. And then they also added in an underlying, you get a point for any underlying condition. Before, it used to be that you only, the ones here on this list, and some of them were age limited, so much easier to qualify for a prescription. There are pharmacies across the state, not a ton, that have these medications in-house, but like if you only want to learn one place to send a prescription, this Walgreens, that's called Community, a Walgreens pharmacy, takes prescriptions and mail orders to patients. So especially if you're outside of a metro area, that is probably a good one just to, memorize. This got sent out probably, in the usual way. Some people got 50 copies and some people 0, but anyway, tried to send out just a little bit of a cheat sheet on prescribing. These are not the most straightforward medications, but here's the dosing here of Paxlovid and molnupiravir, some of the considerations when you're prescribing ages, and especially with Paxlovid, you have to adjust for renal impairment and not prescribe it for people with severe hepatic impairment. So anyway, hopefully that came in actually did not come in the Han, but just came out, I think. Anyway, we can attach the PDF. Courtney made one that looks much prettier than the one I just clipped there, and to use as a reference. Again, participating pharmacies are on that link, so you can see this is what it looks like, but you scroll down and see all the pharmacies that have medication in-house. And this one at the top is the Walgreens pharmacy that does the mail order, and happy to take your prescription. Remdesivir, again, this is the one that used to only be for inpatient treatment, now approved for outpatient, is 3 days of an IV infusion. So this is being given through infusion centers, and obviously is not super convenient for patients. Billing, again, patients should not have to pay for these medications, should not pay. pharmacies will bill the very small dispensing fee to insurance, and if people don't have insurance, they will not be turned away. And then these are just, no updates to these contact information, but just for reference. And that takes me to the end of my slides. Thank you so much for hanging in there for all of those. And then I also wanted to turn it over to Chris quick before we do questions, just to show like some updates to the test page.
Let me jump on. Can you guys hear me?
Yep.
Okay, great.
Yes.
I'm going to go ahead and share my screen here. Okay, so please keep in mind, this is beta. Let me see, what am I sharing? Can you see the find a COVID-19 test? Okay. Essentially, this is beta. Some of the things are changing. A couple more things are being added, but this will at least give you guys an idea of where this is going. So to find a COVID-19 test in New Mexico, we're asking, the individual that's putting their information in to just simply add their zip code, and then based upon their zip code, let me admit those folks, the test delivery. Do you want to order a test to your home or find a test near you? If you say order a test to my home, the options based upon your zip code will appear. So for zip codes that qualify for the Project ACT testing program, they'll have the option to click here and order the test for Project ACT, or we're sending them to the federal site. If they're looking for a test near them, if they click find the test, we're going to be promoting the pharmacies as well as all of the upcoming events in the community. These are currently the events that the Bernalillo County Emergency Manager team has added. Richard, if you're on the call, good job. This is how the public will find your events. There will be a listing of all of them that are driven by the COVID testing inventory tracker. And then obviously the link to search the directory as well. So what we're trying to do is simplify the process for somebody to find a test, either by sending them to the resource to order their homes to come, or ordering their test to come to their homes, or by trying to connect them to events in the community that we know have inventory by pushing the pharmacies as well as the events the emergency managers are setting up. Dr. Durham, anything else you want me to highlight here?
No, it's just you are reminding me that one of the projects that we're going to work on is getting a standing order for pharmacies to dispense home tests to Medicaid patients, so they don't have to do that out of pocket and then get reimbursed, which I mean we know is possible but always clunky. So anyway, that is not in place yet, but that will be, and a lot of pharmacies don't have the home tests just because they're out, but that is one other thing that we're hoping to get in place very soon.
Hey, Chris, this is
Yes,
Dan.
sir.
Can I ask a question on these events in your community? Would this include events where you might go and somebody swabs you and tests you and it goes, PCR test, versus you also might be going to the library and picking up a box and to take home? Are both of those types in the events one?
No, so the upcoming events in your community are restricted to what the emergency managers are adding to the inventory tracker, which is tests that people can pick up and take home with them. So if they're looking for PCR events or events in the community that do the swabbing and whatnot, they'll need to search the directory to find a location that's doing that.
Okay. Okay, tricky. Got it.
Yeah, and the challenge here is we don't have, unlike vaccine where we know really what's going on statewide, here we don't have a really good handle on what test is being offered at what location. And so unfortunately, the user is going to have to do some digging as we connect them to the locations that have those tests. Jody, you got a question?
I think it's more of a comment because I was totally confused on this as well, kind of similar to Dan's question is, this is just home test kits. And I don't think it's obvious from the title or the picture, because the picture at the very top shows somebody being swabbed. So I was kind of led to believe that I was being led to a testing site versus where I might get a home COVID test.
Okay,
Even the
that's
title, find a COVID test in New Mexico. Maybe it just needs to be the word home in there somewhere, and then the picture be a little more reflective of what we're looking at here.
that's good feedback. We can swap that out and maybe just use an illustrative photo there. So please keep in mind, this is not this is the prototype. Hopefully the end product will be a little bit clearer. And if you guys have any other feedback, shoot it my way and we'll try and incorporate it as much as we can.
Great. And I don't know, is someone on from immunization program to just, hopefully I explained the NIMSIS issue well enough, but I don't think they were going to be able to join, but please pipe in if you're on. All right. Are there any other questions?
So Rita's asking, how do you get more info about the community testing events? Can you click on the links? Yes, so a lot of that is entered in by the emergency managers. So like, for example, right now, if we were to look in Bernalillo, all of these green pins that we see here are emergency manager events. This page is going through a rehaul as well. But if you click on one of those events, these are this is all the data associated with it. So the Los Griegos Health and Social, I'm not sure if you guys can see that. Let me zoom in a little bit. The general schedule information, if there's any contact info associated with it, and then any further information that will give the user some information. So I guess to answer your question, yeah, we will most likely add more details to these lists to make it as informative as we can to the public. Does that answer your question, Rita?
Yeah, I was just wondering if from that list, if you clicked on one of the event names, if it would take you to that event's information, or do you have to go back up to the map, find it on the map?
I think, yeah, we'll definitely enhance this view a little bit. We just put the prototype together yesterday, so we'll bring some additional functionality to this thing.
All right. And there are a couple questions in the chat. One just kind of confirming the fourth doses are not approved, and that is correct, except for the immunocompromised. So apologies if I got talking and stopped and forgot to keep saying immunocompromised. So yes, and that I think it was just a big topic of discussion last time, what to do with people who had missed that third primary dose, which is why we're bringing it, bringing up what we got from the CDC as feedback on that. But yes, just for routine, there's no fourth dose approved. And then there is a question, okay, is the list for all community for test sites or just DOH? And I guess for the person who asked that, are you talking about passing out the home tests or all kinds of testing? So,
Do you just?
Yeah, go ahead, Chris.
So this list is driven by what we have in the provider portal. If your location is not on the provider portal, you will not show up in here. So to request access, oops, if this screen doesn't look familiar to you, this is the provider portal. You'll need to request access at cv.nmhealth.org. And let's see if I can remember where this stuff is. This is how to request. So under provider info, COVID-19 testing information for providers. Do you want to be listed on the DOH directory as a COVID-19 testing provider? You'll fill out this basic information, submit it, and then DOH will create an account for you. Does that answer your question?
And-
Okay, perfect.
Okay. Great. And then there's another question about like patients calling community health centers asking if they can pick up tests. And it is a little bit confusing because there's actually a fair number of different programs. What I would say is the program, like for Department of Health, the 1 million tests that we had got distributed to emergency managers that have the option of one, setting up events like we've seen in Bernalillo County and City of Albuquerque that are kind of more like drive through the community center and pick up your tests. The other option is to partner with community organizations who can say like, let's say, I think Rio Riba maybe did Meals on Wheels. And so the Meals on Wheels organization said, hey, can we have some tests? We want to, deliver them along with the meals. So, so it's meant to be very flexible depending on, what the community needs were. The first 1 million tests that went out did have a requirement to be focused on the highest SVI zip codes and got allocated that way. The second 1 million that are going out do not have that limitation. So it's just kind of for the whole county. So this is a long-winded answer to your question, but basically if you are interested as a community health center in passing out tests to community members, go through your county emergency manager. They may or may not have tests, but that would sort of be the route to get them. In addition, there is a federal program for FQHCs and community health centers, and which would also be a good thing for you to explore. And you may know about it already, but you can order tests, home tests that will come to your community center and then be able to pass them out. And I think I saw that Eileen was on the call. I don't know if there's anything more you want to say about that. I know there've been delays for that program.
I don't have any good updates. Still some delays. Some folks are getting the tests and some are not. So hopefully it'll become a little more reliable very soon. Thank you. Right.
Yeah, thank you. So I hope that answers the question, and also feel free to reach out, if we don't get your question answered on this, on the call. And I'll just put my email in the chat. All right, are there any other questions? All right. Well, thank you so much as always for joining. Feel free to reach out with questions. We'll see what next week brings. We might actually have a little bit of a lull, in which case, we may send out a cancellation, but there's still a lot of things in the pipeline. So take care, stay well, and thanks again.